Hi there. Good morning, good afternoon for those that are on daylight time. My name is Hector Bigay, and I am a team member from the Navajo and Hopi Families COVID-19 Relief Fund. And today we are doing a segment on beneficiaries that have, the impact of our work on the lives of our people. So first, as before we begin our discussion, let me just introduce myself, and I'll introduce the rest, and I'll have the rest of the panel introduce themselves. So my name is Hector Bigay. I am a team member out of Jedito, Arizona. I work with Amanda Yazzie, who is my team lead, and we cover the southwest region of the Navajo Nation. My clans are Nahlana Nishlon Kiaani Egg Bashishchin, Tlasche Dashineledo Kiaani Enana Dashache. So in English, I am Cheyenne Arapaho, born for the Tiring House Navajo, as my paternal grandparents are the Red Bottom people, and maternal are the Tiring House as well. So I'll go ahead and pass on the introduction to our first guest specialist, Sheila Bedoni. Go ahead, Sheila.
Hi, good afternoon, everyone. My name is Sheila Bedoni, and I work as a SageW supervisor for the Southwest region of the Navajo Nation. I'm originally from Tisto, Arizona, and Adon Enschlenigi ya Ashinishlen, Twadijini Bashichin, Topahadashache, Lesathan, and I'll go ahead and pass on to Matilda.
Good morning. My name is Matilda Johnson. I'm the SageW for Winslow Service Unit and for the Southwest, and I cover Jedito, White Cone, and Indian Wells. I'm originally from Jedito. Pass it on to Dr. Ruby.
Hello. I'm Dr. Adrienne Ruby, Res Vet. I have my main office is in Vilcon, but I also visit on a regular basis Tuba City, Pinion, and Black Mesa. So I'm working on the Western Agency. I've been a veterinarian for a long time. Can you hear me? Hello? Can anybody hear me?
Yes, we can hear you.
We can hear you, Dr. Ruby. Yeah, we can hear you.
I'm low tech person, so I wasn't even sure it was working. Anyway, that's who I am. Oh, and I'm from Oklahoma. So I need to pass it on, but I'm not sure how to do this. But if the next person is connecting, I'll pass this on.
Good morning. I am Marissa Adams. I'm from the Hopi tribe, and I am a recipient of one of the people who got assistance from the Navajo Hopi COVID relief program. I am Hopi from the village of Sitsomobe, and Kokoponga, our fire clan. So it's nice to see all of your smiling faces, and I look forward to hearing your stories. Thank you.
Thank you, Marissa. And lastly, I'd like to pass it on to Rochelle. Sorry, go ahead. Rochelle, can you
Yes. Hi, can you hear me? I am driving. I am so sorry. Yad A Rochelle, Tabahayan Shadow, Hodahishna, Kohana Bashin, Kiani the Shadow, Kiani the Schnella, Egon Conchla. So I was invited, Hector invited me to this Zoom meeting because of the help that I received and when my family was infected. So good afternoon, and nice to meet everyone here.
Thank you, Rochelle, and thank you for parking. On our last special guest panelist will be Jonathan Allen. He is, I'll go ahead and let him introduce himself.
Hello, everybody. My name is Jonathan Allen. The business manager for Piñon Unified School District. I'm out here in Washington, D.C. lobbying on behalf of education, but I just wanted to introduce myself. I have been with 5 years with Piñon Unified School District, and I have been a part of the Navajo Hopi COVID relief right from the beginning, and I did help my community, Piñon, help distribute a lot of food, and thank you so much to all our donors. Thank you to all the volunteers like Hector and Ethel, and that has been a huge impact to our community. Without Navajo Hopi COVID relief, we would not be able to do the things that we're able to do in Piñon and help all the people that we were able to help. I think we served about 150 people a week at one point. Yeah. So for me, I was a distribution lead for Piñon, Arizona, which is a small community in northern Arizona. And, everything that went through the pandemic, just trying to go through everything that has happened, it was a lot. And right now we're here at Washington, D.C., just advocating on behalf of the school district and also on the behalf of the Navajo Nation, just advocating for our students and also for all the programs that we need on the reservation. So for me, I'm Likatene, Kopaha Bashishu, and my I grew up in Piñon my whole life, and I did go to college at Fort Lewis, and I graduated in 2011 with a business management degree. And from there, I went on to Eastern Navajo as an accountant. And I served 5 years out in Eastern Navajo, going to all the rural locations and helping the chapters out there get what they need. Then I moved to the school district. I'm here now. And I think this is where I'll be for quite some time. Education is my passion, and getting necessary resources out to our students and for our community is one thing I strive for, all because of my parents and what they were able to do in the past. So yeah, I'm full-blooded Navajo, and it's a pleasure to be here. Thank you.
Thank you for that, Jonathan. And thank you all for the introduction. And really, thank you for taking your time out to be a special guest to this panel. Those that are just joining in, I'd just like to share that I am Hector Bigay, hosting a special segment on our beneficiaries who have received direct relief aid from our organization throughout the height of the pandemic. So as we begin here, I'd like to just say that, as Omicron variant along with the Delta variant grew, we from a team member point of view have noticed the increase as far as the numbers, going up, accumulating. So the first question to the panel would be, when was your family exposed to COVID-19? And I'm gonna send this question to Marissa. I don't know where you're at on my end, but you look like you're right here. So Marissa, when was your family first exposed to COVID-19?
Thanks, Hector. So our family, throughout this whole pandemic, I had a baby, and so we've kept to ourselves. We pretty much isolated because my husband was out working, so we didn't want to, if he was exposed, we didn't want to expose anybody. Thankfully, we stayed safe, and we didn't even visit our parents, and mostly because our grandparents live with our parents, so we wanted to keep them safe. But on Christmas Day, my husband took my daughters to his mom's house just to drop off some presents, and she invited them in, and unfortunately, she was, they were exposed there. So we were exposed on Christmas. My daughters were exposed on Christmas, and my eldest daughter, who's 5, she developed symptoms a couple days later, and that's when we were all exposed to it. So we were infected. It was kind of like a dominoes effect. It was my daughter and then me, because we isolated immediately when she started showing symptoms. So my background is in public health, and so I'm well aware of all of the things that the protocols and stuff that we needed to do. So as soon as my daughter woke up, you know, your kids, you know, she wasn't fevering yet, but she just wasn't herself. And I knew that she had been exposed to people that were not in our household. And that's the only exposure we've ever had. So we immediately isolated at that time. And I waited a day. Then we finally got her tested and she was positive. And that was so heartbreaking, because when you have young babies, I think we become mama bears when something like this comes up, and we don't want anything to happen to them. So I was really scared, because you hear in my line of work, you hear from, oh, it's very mild, no symptoms, to very extreme, where in this case, the county was having a high population rate with their pediatric units. So I got really scared, because I have a 5-year-old, a 3-year-old, and a baby. And we did the best we could to isolate in a separate living area. And then a couple days later, I developed symptoms, so I knew I had it. And then probably 3 days after that, New Year's Eve, my middle daughter, she developed symptoms. So it was hard. We didn't want my baby to be exposed, so we tested her again. We did a regular PCR test, and then we did a rapid test for her to make sure she was negative, and we sent her to my mom. But it was chaotic in my head. Like, I don't want my mom to be exposed, because she takes care of my grandfather, and we just had this long discussion, and it was a lot of family planning of isolation from each other. And after my middle child got it, then my husband got it. So it was just like pretty much a whole month of being isolated, where we were all able to get over our symptoms. So that was kind
Thanks
of,
for sharing that, Marissa. Completely understand the domino effect. I think that's how majority of cases were developed, from that domino effect. And I'd like to turn it to Dr. Adrian Ruby. I'd like to ask you the same question. When were you exposed to COVID-19, and how did it affect you and your business there?
Well, I have worked through the whole epidemic, and probably my help didn't like it. The people that worked for me wouldn't go with me, but we even worked to the city, and that, which at that time when it started was the hotbed. But as soon as I was allowed to work there, I went there. I've been lucky. I've probably encountered it many, many times, but never contracted it. But I went to Oklahoma to visit my kids for Christmas. And when I went, I was going to see all of them, but one of them called, she's a doctor, and said, I've been working with too many COVID people, I'm not going to come. And then my son, since I had done all the testing to make sure I was safe to go, my son went and got tested before I got there and found out he had COVID. So I didn't get to see him because he was isolated. But on my way home is what happened. I flew, and in the Phoenix airport, my luggage got lost. And I was walking from one end of the airport to the other. I was there over an hour and a half, milling around the airport, trying to get my luggage, trying to connect with my ride. And I'm sure that's where I got exposed. Came home a few days later. It was really cold in my office because I blew all the fuses with little heaters trying to heat it up, and blew the fuses. There was no electricity. So I spent the whole weekend in bed with all the blankets I had and thought that I was just cold, but I wasn't. That's when I got COVID. And because I had put it on the internet that I wasn't feeling well and my electricity was out, I got a lot of attention. And as soon as I took the test and found out for sure I had parvo, it was people to the rescue. Hector came on my birthday. January 6th is when they brought the supplies. I couldn't believe there was even fresh hamburger meat. I mean, I was so thrilled at what I got. And then I had a few of my clients who actually went into town, bought blankets, bought little heaters. I was just overwhelmed with the response. Even the Navajo Department of Agriculture and the Department of Natural Resources put funds together and brought me blankets. They brought a really good heater. They brought so many things, and it was delivered by Miss Navajo in person. I could not believe it. Of course she came. She's worked for me since she was 12 years old. And I just couldn't believe the response. I thought, boy, if you have to get COVID, the Navajo Nation is the place to have it. And I still have some of the supplies. I don't have to go out of my house. I'm still eating from some of the stuff I got back then. And I was very lucky. It was like a bad cold or the flu. And I didn't get a lot of the symptoms I should have expected. It was just, I didn't feel good. I was sick. I slept all the time, and I'm still sleepy, but I was even able to do limited work while I was sick. I'd have people leave their pet on the doorstep, and then I'd go out and get it and bring it in, doctor it, and put it back on the doorstep. So the COVID experience for me was basically positive because of all the help I got. And Hector was the first one out here with a truckload of stuff they'd got at bashes and all kinds of things to save my life. And I am really grateful. I pride myself independent and not having to ask for help. But boy, it was nice to have help. You don't have to do things alone. And I'm grateful to find that out. Thank you, Hector. Thank you, everybody who brought things for me. You made it almost a positive experience. I mean, to where it was a good thing. It was a good thing to find out how many people there are out there who want to help you. So thank you for letting me be on this program and share my experience. I'll pass it on.
Thank you, Dr. Ruby.
So Hector, you can, I can hear you now.
Yeah, once I found out through social media, through one of our group pages that I follow, I seen that you were sick, you weren't feeling good. And again, this was during the height of the, rising of cases. So for me, it's part of the empathy that we as team members have, and also because I'm human. But I wanted to jump on that as soon as possible. I wasn't trying to wait for your isolation kit assistance request form submitted. I was just trying to get there ASAP before anything could get any worse. And with that, I'd like to also direct the same question to Rochelle Tabaha. We've met from prior nonprofit organizations and all. And when I had seen your name on my requesting list, I had, it broke my heart knowing, because these are people that I know and I'm familiar with. But Rochelle, I'd like to pass it to you also. When were you and your family first exposed to COVID-19? And yeah.
Well, it was beginning of January, and after the holidays passed, and again, like Marissa stated, it was my youngest daughter out of my family, my household. She was the only one who was not vaccinated at the time. They didn't have the shot available to the younger children. So she was the one who was in contact. We don't know where, we don't know how, but she was back in school, and that's when the high peak of COVID was going on, and it was all based on she was the main one who was getting the symptoms, and it was like, hey, we can't ignore this. So we got her dad and I took her in, and she was positive, and maybe it was from my work or her dad coming home. We don't know, but it was beginning of January, the second week, I believe, after her first week back into school, and all of this. There's all so many angles of where she could have contacted the virus, but we just did our best to help her, and then to help ourselves, because again, like Marissa said, it was that domino effect that all of us, everyone in the household was sick. She was contacted right next day was like me, and then her dad, and then her older brother and her older sister. So then it was just all of us. So we couldn't isolate because we didn't have much place to go. So we just ended up all isolating together. And through the help of the Hopi Relief, Hopi COVID Relief program, we were able to get through and get the supplies that we needed at the time, because it was like, who was going to go out for us, who was going to shop for us, kind of thing. And we don't want to rely on my parents to do that, because we don't want them to get sick. And like I said, it was the high peak of this virus in the beginning of the year. But that was our experience, and I guess it also brought us back together as a family. We got closer and back again to our roots of how to take care of ourselves, and a lot of self-reflection. So it was, I guess you could say, a beautiful blessing. It's not beautiful, but an ugly blessing in some sense. But it also, just like I said, helped us refocus, and got to reflect on ourselves, and then how to take care of ourselves, how to prevent again in the future. But right now we're all well, and very thankful for family members who have stepped up and who helped us out as well. That was our first contact at the time, though. So yeah.
Thank you for sharing that, Rochelle. And I really appreciate that truthful testimonial that you're sharing with us. The next question that I'm going to bring up, this will be for Sheila and Matilda. And Jonathan, you're welcome to. No, not you, Jonathan. This is not yet. Sorry. So the next question is, how severe did your symptoms get? And I would like to direct this to Sheila and Matilda, because they are also essential frontline warriors. They're out there as community health representatives, checking up on our elderly, always, being exposed to, sick people at home. Some people don't even share that they're sick, but Sheila and Matilda are also recipients of our isolation kit from our direct relief program. Me and my teammate Amanda had delivered to Sheila. Once we seen, I'm not gonna lie, it wasn't just these two, it was their other coworkers also. But once I seen their names show up on our assignment list, it really broke my heart. I mean, these ladies I've worked with from the beginning. of the pandemic started, they've came out to Jedito Chapter House to assist with public distributions. They've went out of their way to, help assemble, sanitize, and even make deliveries to these homes that were way, I'm talking about way out there that I was even familiar with now. But Sheila and Matilda, when you had caught COVID, how severe did your symptoms get? Yeah, let's start with you, Matilda.
My symptom was like I had body aches on the first day, and I had fever. My fever was like spiking up to 100. And I was like coughing, and I was like coughing a lot of mucus. So that's how bad mine went, because I use a Butyl for my asthma, and it just got worse. But I still coughing out junk, even though I recovered.
Thank you for that, Matilda. And for you?
So this is Sheila. I just like to begin by saying that as what Hector has mentioned, that as CHRs in the Southwest region of the Navajo Nation, we cover 8 chapters in our area, and it covers both District 5, which includes Loop, Bird Spring, and Talani Lake. And then it also goes into District 7, which covers Tisto, Delcon, Indian Wells, Jedito, and White Cone. So we, provide services in the 8 chapters. And when COVID began, and we were the ones that were out in the field providing services, checking on elders, and providing health education to all the different communities. And so we started looking for resources such as food, water, essential items. I had to look different places, and there was a lot of resources that were providing essential items. So we started getting those, and we started delivering them to each home. We would start in one community and make our way to the next one, to the next one. So we all work as a team. And so that's how we work for ever since before World Health Organization declared a pandemic. So back in November of 2019, that's when coronavirus was identified. And then in December, we were providing health education at the chapters within our service unit in the Southwest region. And by January, February, that's when one of the first cases came to the United States and California. And then by March, it hit the Navajo Nation, everybody was, and then it just, the numbers started going up. So we, as CHRs, we didn't have a choice. We would come together in the morning, and we would talk about how we felt, because every day we went out into the field. We went out. It was like an unknown. We didn't know what was out there. We didn't know if we were gonna contract coronavirus, or we didn't know. No information on COVID-19. But we went out there and we continued to help. And so since 2019, 2020, 2021, and it was actually 2 years since COVID came to the Navajo reservation. And during Christmas, I didn't plan Christmas. I didn't plan on nothing. I stayed home, and my mom and my daughter went to my brother's house, and then they exchanged gifts, and they came back, and then everybody started coming to the house, and they were dropping off gifts, and they were picking up gifts. And it was Christmas Eve when my dad and my mom, they came to the house, and they came in the evening and they asked if they can spend the night. So they actually stayed there Christmas Eve, Christmas Day, and they stayed there all the way until Monday. They stayed at my house. So Saturday, my dad was saying that, oh, I don't feel good. I guess they had dinner in Flagstaff and the electricity was going off and on at the restaurant they were eating at. And he says, I think it's the food that I ate. And then by Sunday, he sounded like he had a cold. So, I started giving him over-the-counter medication. And so by Monday, I wasn't feeling well. And I actually went to the clinic and I got checked because, I was like having sinus pain and I had headache, but I didn't have a fever. And I got tested and my test result came back and it was negative. And this was Monday, I got tested, and then Wednesday, I got my test result back. And so that's what happened. And then Wednesday, my son called me and he says, my son works out of state. So he was on his way back and he says, Mom, let's go down to the valley and, I want to visit my other siblings. I want you to go with me. So my daughter and I went with him, thinking that my test result was negative. So we went down to the valley. We were over there Wednesday, Thursday, and then Friday morning, my dad called me and he said that he tested positive. So I was like freaking out. My daughter and I, we got tested. My test result was negative again, but my daughter, her test result was positive. And so she got tested again and it was negative the second time. And this was Sunday. So Sunday we came back here to the reservation. And when we got back, my husband was sick and he had got tested. So he had got tested that Friday before New Year's. He didn't get his test result back until Tuesday. When he got it back, he was positive. So, but that's what happened. And it was like a couple of days after I actually came home from Phoenix is when I started feeling the symptoms. And the symptoms I was feeling was like I was really tired. I had my head was hurting and I started to feel congested and I just didn't want to do nothing. I just, wanted to lay down. I wanted to sleep and, I didn't have no fever. My body was aching, I had my muscles, my joints, it was, hurting. So that's how it was off and on, off and on. And I think after maybe 2 or 3 days after I started getting the symptoms, I was like at my worst for like 2 days. I was literally just like laying in bed. But I did reach out to Navajo Hopi COVID relief and I did contact Hector and let him know. So, Hector and Amanda came over and they delivered, the items and, it was like it was a lot of stuff, and compared to, what we were giving out to the community members. And, it was really helpful. And I think that one of the things that I was like really thankful for is the Pedialyte. I was like, this is what I need, and the cough drops, because I was coughing, but it was like a dry cough, and my throat was itchy, and then just the over-the-counter medication, and also the humidifier that was like really, really helped me, especially at night. So, with all the food and then the soup, that was really, really good. I mean, it was a lot of stuff, but it really helped me and I sure appreciate it. And, thank you to, all the donors that, donate to Navajo Hopi COVID relief, without their donation, all this wouldn't be possible. And I think that, it made me think about a lot of things like, some of our relatives, are no longer with us. And we were the fortunate ones to get the vaccine, to get both vaccine and the booster. I think that was one of the, one of the positive things as far as, testing positive for COVID was that, we were able and, the vaccine was available for us. And I'm very appreciative of, the vaccines being available to us as well. So, and also the donors and, just Navajo Hopi COVID relief. And I'm very, very thankful for Hector and Amanda. There's times that, they're like, can you help us? And, we try our best to help them, because there's only two of them covering a vast majority of, the Southwest region of the Navajo Nation. And there's even times that they'll go out and they'll be in Chinle, or they'll be going to like Ganado area. And, that's like a really big area to cover. And, I, for one, would understand, because as CHRs, just covering the eight communities within our, within our community, that's a lot. And for them to go to other areas and to help other families and, that were, impacted by COVID. And I understand, as a CHR, we are the ones that are educating, this is, the protocols, this is what you need to do and all that. But when it actually comes into your home and it actually affects you, honestly, I didn't even know what to do. I didn't know, or like, what am I supposed to do? What was it, and it, it's good to have somebody from the outside talk to you and to kind of like put you back in check, because we don't know. All we hear is stories about, this is what happened, this person lost their life to COVID, and to this day, we still provide services to what is now called long haulers in the medical terminology. Long haulers is the ones that are still affected by COVID, even after, they come back from the hospital, or there's even some patients that went to rehab. There's even some patients to this day that, they still have to have oxygen 24/7 because, their lungs are still not strong enough, even months after they've, recovered from, or, after they've tested positive for COVID. So those are some of the things that, that I've seen out in the community with our relatives and, with our people. And I'm pretty sure it's like that, worldwide. And I just like to, mention that. And, it's good to see that you guys are all here, your beautiful faces, and to know that, you guys are okay and you guys are well, and, that, you're going to be healthy again, the way you were. Maybe there's times that where I felt like I was still like very forgetful, like my mind is still blank, or there's times that where when I go for a walk, I can feel, my heart rate rising, or I get tired really quick, even though it's been, weeks after, I tested positive, I still feel that sometimes. And I'm pretty sure, some of you are like that. And, I just like to, just to tell you that, continue to stay strong and continue to go forward. And, thank you again, Hector, for inviting me and being a part of, the panel, and to talk a little bit about, my experience and what I went through and how Navajo Hopi COVID relief helped me. And I'm pretty sure you helped a lot of families. I know we were there from the beginning when you were doing the drive-through, and we would take our team out there and we would help you. There's times that where you guys fell short, and we would go over there and pick up whatever and deliver it for you guys. And so we try to help each other in that way, and to have that teamwork. And it's good to have teamwork, because we all provide services to the same, to the same people and to the same community. And I'm appreciative of that. And I just like to say thank you, Hihan Sago. And that's it.
Thank you, Sheila. I really appreciate you also, along with you and your team. Jonathan, I have a question for you. Did you catch COVID by chance throughout this pandemic?
Actually, I've been very fortunate to have not caught COVID. But I know some of my sister did, and of course, all the people that we helped through the pandemic. We lost 2 employees at Pinyon Unified, one early on in the pandemic, Miss Rose Bly, our secretary at the elementary. That was really tragic. That happened within the month after the pandemic hit the reservation. Our hearts really go out to her and her family. It still brings tears to my eyes. She was such a caring person. And, it really hurt us. It really hurt our community. We lost so many people, but it was, thank you to everybody, because like the CHRs were the ones who really got to the families out there and really helped the community. And of course, you, Hector, and Amanda, and all the families that we were able to help. The quality of food that people, they love the food that we were able to get to them. Early on in the pandemic, everything was shut down. It was hard to get food resources, and it was such a hard time, especially on the school side too. We had to shut down. Kids were home. We had to send bus routes home to feed kids, and that what Navajo Hopi, there was no one servicing the area. And what I've been trying to tell our Congress people here is our area is so huge. As soon as it rains, roads, you can't pass through the roads. You can't get resources. People are stuck in their homes. Navajo Hopi COVID Relief was the only organization that came out and provided direct assistance. For us, we served out of the district gym at Pinyon Unified School District. We had huge lines. I mean, the lines went around the whole bus parking lot. And we were only able to give one box per family. And there were so many families that needed help and assistance. And to this day, the need is still there. It's very high. We have about 20 children in our district that are homeless right now. And I try to use resources like Navajo Hopi to kind of assist those families. We don't get as much food as we used to, so I prioritize, we kind of work with other organizations as well, just to get what we can and get food to those families that extremely need it, because the need is tremendous on the reservation. Both Hopi side, because on Pinyon, Hopi's right there. Just like Hector deals with, he's right there on Jedito Island. He has a lot of Hopi relatives right there, and they have a tremendous need as well. So yeah, I just want to thank you to everybody. The direct relief assistance, it had, you can't even describe how many lives have been saved. We lost a lot, but there was probably a lot more people that have benefited from this. Just thank you.
Thank you for sharing that, Jonathan. I really, really appreciate that. We're coming down to the end of our segment here, but before I go, I have one more question I would like to ask, and this would be for Marissa, well, all of you except for Jonathan. What are some of the items, as Sheila mentioned, like Pedialyte and cough drops, what are some of the items out of the isolation kits that we provided that helped you and your family? And we'll start with you, Dr. Ruby. I'm sorry, Dr. Ruby, you're on mute. Can you unmute yourself, please?
There, I think I'm unmuted now. Can you hear me? Good, okay.
Loud and clear.
My family, when you say you and your family, my family includes all the people that work for me, and every one of them got COVID after I had it. And all of us, one of the people that works for me got really sick because she has a lot of other health problems, and she's still struggling with them. And the supplies that you brought for me were shared with the rest of my COVID family. And the humidifier was, you would think of things as other people were talking. The humidifier was really, really necessary. I got this great little thing you put on your finger that tells you how much oxygen you have in your blood. And I was like taking it 10 times a day because it was so much fun to play with. And I was surprised how low it can get when you're having trouble and doing a lot of coughing. The heater, those were things physical things that were so helpful. And the medicines you brought, I even forgot about that until somebody else mentioned it. I was able to share them, and we even got a test kit, which everybody was using the test kits that worked for me. So the supplies were all appropriate. Everything was. When I first looked in it, I thought, well, what am I going to need this for? I used it all. And the water was also, I still have a little water. It was all very much appreciated. I don't think there was anything that I didn't use. Y'all really thought it out. Thank you. I can pass that on.
Go
if
ahead,
you want to
Marissa,
ask
and then-
anyone else about it.
Thank you,
Oh.
Dr. Ruby. I appreciate that. Go ahead, Marissa, and then we'll go with
Man, when Hector pulled up with his van, I was like, whoa, fit into my little driveway. But when I had called him, because I was referred to him by a family friend who just utilized their services too, they had this whole list. And I was like, I was just in shock, because these are things, that sometimes we take for granted, and things that right now during that time, things were going off the shelf. Vitamins, supplements weren't even available. And so when I saw that on there, I'm like, yes, we needed zinc, we needed vitamin C, and the Pedialyte pops. Like, my daughters do not like Pedialyte, but I knew we needed to stay hydrated. So having them bring that, I was like, I was just so grateful for it all. The COVID test, we were able to have one each. So I was so thankful, because when we had it, my family was like, we'll look for some tests, and they couldn't find any. And I'm like, we got some in the box. So I was super thankful and grateful for that. And the food, oh my goodness. My daughters eat a lot of fresh vegetables and fruit. And so when I saw that list, I wanted to check all of them, but I knew, numbers are rising, and I was trying to be like, okay, we can't go without this. Maybe somebody else needs this. But my daughters, when they saw the bananas and stuff, they were so excited about it, because it was right after Christmas, and we did our bulk Christmas shopping like maybe a week and a half before. So by that time, our fresh stuff was pretty much depleted. So I was really grateful for all of that. And my husband was doing the cooking. So he was like, thank you. This makes it so much easier. Like the soup and stuff, because he didn't know how to make it really much. But those were the things that I was grateful for mostly, was the vitamins and the Pedialyte and the fresh fruits and vegetables. But I'm just so grateful. And I was in tears listening to Sheila and Rochelle's story of the effect that it had on us, because it's not only a physical effect, but emotional and mentally. It probably took a toll on them too. And just talking about it and being able to be open, because I really hadn't shared my story with anybody. Thank you for that. Thank you for sharing that, because that helped me. And I felt it in my heart. And I'm so grateful for the CHRs and all of you here in this call who have gone out of your comfort zone. You didn't know what you were getting into. But thank you, Asquali and Asqualita, the Navajo Hopi COVID relief program, because Hector was like 2 hours after I submitted my application. I didn't know what to expect, and he was calling me, and I was like, by the end of the night, we got our groceries, and we live out in Hopi, so he had gone from maybe Jedito to Delcon to Loop, and then all the way back to Hopi. So just this big triangle. And I can't thank this program enough for helping us when we really needed it. So Asquali.
Go ahead, Rochelle. Thank you, Marissa.
Just like Marissa and Dr. Ruby stated, I used everything that was given to me, and we're a family of 5, and I know there were some things that you were also running short on, but what we did get, it helped us. We used everything, all the vitamins that were given, all the medications, because even from the, headaches, the body aches, those things went. I mean, those were like, boom, they hit you and you were just in bed. So those were some things that we needed to help us. And like Marissa said, my husband was also the cook for us, and he was out there. And then for us to be like isolated, we would just like sunbathe too. It was just felt good to be outside, and it was good too when we were hit with the COVID. We were weather was great. The weather was nice, so we were outside. We were trying to work out of this body ache, work out of our headaches, and just be outside and to have the fresh air instead of masking up while we were inside. So it was good for us to be outside. So we kind of used that as an advantage. And then when we knew our body was getting tired, we used medication to help calm us a little back inside. So the vitamins were good. All the food you got, Hector, that was enough for us. And we used everything. None of it went to waste. And we, my family and I, we appreciate it. And it was more than enough. You guys went way out of your way to help myself and my family. And I'm very thankful for that, to all the donors. And we also had one of our local CHRs in the cornfield area come out. So she also brought some things over. And, we had more than enough within that time. Even though it seemed like, they told us quarantine for like 7 days, it seemed like it was a long time, but it really wasn't. And everything we did receive, we did use. So none of it went to waste. And but what I liked about your package that you gave us was the at-home test kit. That was good for us to use. That was probably the number one thing, so we could monitor ourselves within the days that we were in isolation, and then when to finally come out of isolation. That was the one thing that was good for us, because we couldn't go anywhere. And then the medication that was given to us and the vitamins, those were the necessities that we needed. And the cleaning supplies. At the time, we moved ourselves out of the home and we went into a hogan. So we had to find things to help us get through the time of us being in isolation. So those were the important things that we were looking for. And with the Navajo Hopi release, it was good to receive those items, and we used those. So those were the three basic ones that we really use, and I appreciate. Then the food and the water that came along with that. And very thankful though, Hector, you and your team, for doing the work you did. I know you guys were saying you couldn't make it from one end. You asked to see if we could meet you in or was it Delcon? And we did. So my husband left because he was fine by then. So that's when we knew, the at-home test kits were good to find out when we could, when one person was finally testing negative, they were the ones to finally fully go back to the house. So, but thank you very much.
Thank you, Rochelle. Thank you, Dr. Ruby, and thank you, Marissa, for sharing that. I do have to close up our session here, but on that note, before I go, I want to do a shout out to all of the CHR workers out there, not only from Sheila's team, but also from the Fort Defiance Agency, the Western, the Northern, the Northeastern, the Eastern Agency. all Navajo Nation community health representatives had played a big part into assisting us team members from the Navajo and Hopi Families COVID Relief Fund to be able to provide necessary relief aid to those families that were in need. So it was a collaborative effort, and I'm very grateful for every single one of you, because without your help, you know, we would have had trouble beforehand. And also, I want to say thank you very much for coming out of your comfort zone to come and join me on this panel here to share of how COVID-19 had impacted your families, along with receiving the services here. And with that being said, I'd like to excuse you for the rest of the day and say, Yeha Alnido. You know, may the people have strength and fortitude, and keep wearing your masks no matter what, and just stay safe. But apart from that, Ahiahado Hagone.
Hector, before we end, I just like to add one more thing. I just want to say thank you to
Sure.
Ethel French for starting the Navajo Hopi COVID relief. I remember when COVID first started, she had opened up, I think it was a GoFundMe account, and there was a team that we met in Winslow at Winslow Indian Healthcare, and she gave us like food to distribute in our community. And from there, you know, it just grew, and, you know, it's, you know, Navajo Hopi COVID relief, you know, it's where it's at to this day. So from the beginning, you know, when COVID first started up to now, and, you know, I just like to, you know, say thank you to Ethel. I appreciate, you know, her, you know, going, you know, stepping up and, you know, putting together. Now it's an organization. So congratulations. So, and thank you. That's all I like to say.
Thank you, Sheila. I'm going to be reaching out to you, my special guest panelist. I'll be reaching out by email. Thank you for your participation, and you have a great rest of the day. Hagone.
Okay, we'll see you, Hector. Bye.
Bye, Asquale.